Welcome to the Advancing Surgical Care podcast, brought to you by ASCA, the Ambulatory Surgery Center Association. ASCA represents the interests of outpatient surgery centers of every specialty and provides advocacy and resources to assist them in providing safe, high-quality, cost-effective patient care. As with all of ASCA's communications, please check to make sure you are listening to or viewing our most up-to-date podcasts and announcements.
Hello and welcome to the Advancing Surgical Care podcast. My name is Bill Prentice. I'm the CEO of the Ambulatory Surgery Center Association and the host of this episode. We're recording at ASCA's annual convention and expo in Denver, Colorado in April 2025. And my guest today is Robert Saltaformaggio. Robert is a senior counsel at Liles Parker, a Washington, D.C. law firm that focuses on regulatory healthcare compliance and reimbursement issues. He works with a wide range of healthcare providers, including ambulatory surgery centers. In addition to being a licensed attorney, Robert is also a certified professional coder, which has allowed him to assist providers assessing whether claims meet applicable Medicare, Medicaid, or other public payer coverage and payment requirements. And Robert also handles claims disputes with major commercial payers such as Blue Cross Blue Shield and UnitedHealthcare, subjects that he addressed in a presentation here in Denver this week. For these reasons, I thought our listeners would benefit from a few minutes of his experience and expertise as it relates to dealing with audits by both public and private payers. Robert, welcome to the podcast.
I appreciate it. I'm glad to be here.
Well, thanks. Well, let's begin with the first portion of your presentation where you discuss administrative claims audits being conducted by payers against ASCs. What can you tell us about the current state of play, particularly the higher frequency inquiries for things like improper payments for errors or miscoding?
Sure. Well, I think across the board, we're just seeing an increased focus on program integrity. So we know with the new Trump administration and in particular, the DOJ, entity, that we're seeing them focus on identifying and combating waste, fraud, and abuse in the Medicare, Medicaid, and even the private payer atmosphere. So with that increased focus, we are seeing a number of administrative audits being performed, and as well as an increase in those audits. And they're really running what I would call the alphabet soup of contractors and audit types, whether those are CERT audits, TPE audits, the targeted probe and educate, the additional documentation requests, the UPIC audits. They're expanding across the country, and they're really covering a wide range of specialties, and including ASCs. And what's really, what I'm seeing as a focus is kind of a data-driven approach. So the government and these Medicare contractors are using AI, these specialized tools to really identify any potential billing anomalies.
Right. And I imagine that AI misses things and kind of messes things up at times also, right?
Yeah, it can. I think the government sees it as both a benefit and a burden. There are nefarious actors out there who are using AI to, submit false claims, generate false medical records. But, unfortunately, the government is again using AI to really scrutinize providers who are outliers with respect to their billing practices.
So it's the robots battling the robots at times.
Exactly. But as we know, robots are not always, identifying correct claims, where that really puts the burden on the provider and the ASCs to kind of push back and fight back and say, look, my documentation practices are correct. My billing practices are correct.
Right. And so given the time and expense associated with audits, what are your recommendations to how to reduce their risk and improve compliance? I know you went into a great amount of detail during your presentation here this week, but if you could sum up some highlights, I think that'd be very helpful to our listeners.
The biggest emphasis is just establishing a strong compliance plan. I refer everyone to the 7 elements of an effective compliance program. And I think some of those elements are really important here. 1, just conduct regular training. The guidelines and the medical necessity is a constantly changing atmosphere. So you really need to stay up to date for you as both the providers and your administrative staff. Second, I'd really want to see providers develop and implement effective lines of communication. So this creates an environment where providers and employees feel comfortable, reporting any potential compliance issues. And then finally, I think one of the biggest takeaways is just regular internal audits. So these self-audits can help ASCs identify areas in which their compliance program can be improved. So that includes regularly reviewing your billing and documentation practices so that you can rectify any potential issues before you submit those claims for payment.
Really important things, and I'm sure listeners and the audience here really appreciated you giving them that guidance. Let's shift gears to some of the more serious and potentially more consequential impacts of being placed under investigation. What's your best advice for both avoiding jeopardy and trying to maintain business as usual while you're responding to an investigation?
So I think when, an issue escalates from a simple audit to an investigation, I think my first step I would recommend any ASC is to retain counsel. Because again, when you get the investigation involved, that's usually, they've identified either some kind of credible allegation of fraud or really serious billing or documentation practices. Second, if you receive notice that you're under an investigation, I'd want to know, what is the scope of that investigation? Are you being investigated because you're the target or the subject of an investigation, or are you simply a witness? Third, preserve any evidence. So documentation, whether it's medical records, emails, you want to make sure that every bit of evidence, in fact, that the government can use in that investigation is preserved, and they don't try and allege any nefarious activity. And then finally, be truthful and honest, because the government can sometimes, and we've seen where they get providers and AFCs on issues of lying to the government that supersedes any allegations of, fraudulent billing or fraudulent documentation practices. So the number one takeaway is just be truthful and honest with the government, and it's going to just help those investigations move along a lot more smoothly.
That's great advice. And I think, again, I hope if our listeners are in that bad situation, I hope that they first retain counsel, because I think that is probably the critical first step. Rob, you won't mind if we're going to take a break here to hear a word from our podcast sponsor.
This recording of the Ambulatory Surgery Center Association is being brought to you by Surgery Partners, a leading operator of surgical facilities and ancillary services with more than 200 locations in 33 states. Surgery Partners offers multiple types of healthcare services that deliver high-quality healthcare in a convenient and cost-effective manner. To learn more, visit surgerypartners.com.
Your presentation today also covered more than a dozen compliance risks that ASCs face. Time doesn't allow us to cover all of them, but can you highlight a few and your best advice for avoiding or at least mitigating the risk?
Yeah, absolutely. I think one of the biggest takeaways relates to the anti-kickback statute. So, just briefly, that statute says, you can be held liable for any referrals of business to you. So what we always recommend is providers really need to scrutinize any business arrangements or contracts with entities that can refer business to your practice. There are safe harbors with the anti-kickback statute, but those are really nuanced and complicated. And so in those instances, I really recommend you reach out to counsel to review those. Second, really, again, going back to that self-auditing to review your documentation practices and your billing practices to ensure that, you're not submitting claims for unnecessary services or you're not doing any improper billing. Third, I would really scrutinize your credentialing and personnel files. In particular, making sure that you haven't employed any individuals who are on both the federal or possibly state exclusion, because, any claims and services that they may participate in can not only taint those claims and lead to an overpayment, but then can also lead to liability for you and your ASC.
Robert, one thing that I'd be interested in hearing a little bit more about is, can you tell us the difference between a public and a private audit?
Yeah, absolutely. So when we think of public payers, that's Medicare, Medicaid, TRICARE, any federal or state healthcare program. And what's great about these audits, if there's anything good about them, is that a lot of your appeal rights and deadlines are set in statute. So, if you get audited, you have X number of days to appeal, and the certain levels of appeal that you can ultimately go to. Whereas with a private payer, so that's going to be, your United, your Aetna, any of those private insurers, they're going to do their own audits. And unfortunately, a big difference that we see is that a lot of your appeal rights, if you engage with those private payers, are going to be outlined in those contracts. So it really is important for you as an ASC to review those contracts, because what we found is a lot of your appeal rights are really narrowed compared to the public payers. So you might only have 30 or 60 days to appeal a denial of a claim with a private payer, whereas you might have 120 or even up to 180 days to appeal a claim that has been denied by a public payer. And, even then, with a private payer, you may only have one level of appeal, while with public payers like Medicare and Medicaid, you might have multiple levels. So while it might be easy to find all these rights with respect to public payers, If you engage with a private payer like Aetna or United, you really need to go in and review and scrutinize your contracts because that's going to outline all of your rights as a participating provider.
And I imagine it's not much easier to change those or negotiate out those contract terms than it would be to change the statute.
It's going to be on page 60, line 5, embedded in paragraph 3, whereas I can easily go online and file my rights with respect to Medicare or Medicaid.
Right. Robert, this has been fascinating, and thank you for being a presenter here in Denver. I know the attendees shared my appreciation for your knowledge and expertise, and thank you for spending some time with me today on the podcast.
Well, I appreciate the opportunity to be here, and thank you, everyone.
So before concluding, I would like to acknowledge the support of our podcast sponsor, Surgery Partners, a leading operator of surgical facilities and ancillary services with more than 200 locations in 33 states. Surgery Partners offers multiple types of healthcare services that deliver high-quality healthcare in a convenient and cost-effective manner. To learn more, visit surgerypartners.com.